Okay, let's dive in. You know that feeling, right? When you maybe stayed out in the sun just a bit too long?
Oh yeah, that hot pink skin.
Exactly. That's a burn. A minor one, sure, but still a burn. But what happens when it goes, well, way deeper than that?
Right. And that's what we're digging into today, isn't it? The whole world of burn injuries.
Yeah. We've got some really interesting source materials here, kind of like the essential toolkit for understanding this stuff, from causes right through to treatment.
Looks like exam objectives and maybe a cheat sheet. So, focusing on the core knowledge.
That's the plan. Our mission, let's say, is to really pull out the crucial bits, go beyond just, ouch, that's hot, and understand why burns can be so significant.
Well, it's fascinating just how many ways you can actually get burned. It's not just touching a hot stove, is it?
Not at all.
Our sources lay out quite a range. You've got your thermal burns, that's classic flames, boiling water, touching something scorching hot.
The ones we usually think of first.
Right. Then electrical burns, faulty wiring, lightning strikes.
Uh,
Much more dramatic sometimes.
and tricky because the damage isn't always visible on the surface.
Exactly. Then there are chemical burns, strong acids, alkalis, that kind of thing.
Yeah.
Radiation burns too.
Like sunburn, but also for medical treatments, yeah.
Correct. And maybe surprisingly, even severe cold injuries like frostbite actually fall under the burn injury category, mechanism-wise.
Okay, so it's not just heat doing the damage. The way the tissue gets hurt is different too.
Definitely. Thermal is direct heat destruction. Chemicals sort of corrode the tissue.
Uh-huh.
Electricity, well, that takes its own path through the body, causing damage as it goes.
Often deep damage.
Yes. And radiation messes with cells fundamentally. With cold, it's ice crystals forming, cutting off blood flow. Different mechanisms, same endpoint.
Mm.
Tissue destruction.
And it's crucial to remember, like our sources point out, this isn't just skin deep, is it?
Not at all. The initial hit is this, sure, the epidermis, the dermis, but serious burns. They can go way down. Muscle, even bone.
And it's not just a local issue either. A small burn stays put, but a big one, that can affect the whole body.
That's a really critical point. Significant burns, especially if they cover a large percentage of the body, trigger these huge systemic responses.
Systemic meaning, body-wide.
Exactly. We're talking about things like massive fluid loss, a much higher risk of infection, even organs starting to struggle. It gets serious fast.
Wow. Okay, we'll definitely need to unpack those systemic effects more. But first things first, when someone has a burn, you need to figure out how bad it is, right? Assess the damage.
Absolutely. The immediate priority is always that primary survey. ABCs, airway, breathing, circulation, make sure they're okay there first.
The fundamentals.
Always. Then, yeah, you need to gauge the severity. And a big part of that is the extent of the burn.
Yeah.
How much body area is involved.
And we've got tools for that, according to the sources. The rule of nines.
Right. The rule of nines is like the quick and dirty method, good for a fast estimate of the percentage of total body surface area, or TBSA, that's effective.
TBSA just means how much skin got burned.
Pretty much, yeah. The rule of nines assigns percentages, usually in nines, to different body parts, like an arm is 9%, the front of the torso is 18%, that sort of thing.
Okay, so it gives you a rough idea pretty quickly. Useful in an emergency, I guess.
Very useful. But then there's the Lund-Browder chart. Our sources say it's more precise.
Why is that? What makes it better?
Well, it accounts for age. Think about a baby, their head is a much bigger proportion of their body surface than an adult's head is.
Ah, right. Proportions change as we grow.
Exactly. The Lund-Browder chart adjusts for that. It gives different percentages based on age, so you get a much more accurate TBSA calculation, especially vital for kids.
Makes sense. Precision matters there. Okay, so we know how much of the body, but the depth is just as critical, isn't it? Red skin versus, something much worse.
Absolutely critical. Depth tells you which layers are damaged. Our sources break it down into 4 degrees.
Okay, let's walk through them. First degree.
First degree, or superficial burns. Epidermis, only that very top layer of skin. Think typical sunburn. Red, painful, dry. No blisters usually.
Right. Uncomfortable, but they heal okay generally. Second degree.
Second degree, or partial thickness. Now we're into the dermis, the layer underneath the epidermis. The big sign here, blisters.
Ah, blisters are the key for second degree.
Definitely. Very painful. Usually look moist or weeping because of the blistering.
Okay, so blisters mean it's deeper than just superficial. Got it. Third degree sounds significant.
It is. Full thickness, third degree burns. These destroy both the epidermis and the entire dermis right through.
Wow.
And here's the really counterintuitive part. The burn site itself might actually be painless,
painless, but it's destroyed the skin.
Exactly. Because the nerve endings in the dermis that feel pain, they've been destroyed too.
That's wild. A major injury, but no pain signals from the direct site.
It's a key diagnostic clue. The area might look white or waxy or leathery, even charred.
Yeah,
But yeah, the lack of pain is often the big indicator for third degree.
that's a crucial takeaway. Okay, and then there's fourth degree.
Deep full thickness, or fourth degree. These are the most severe. They go beyond the skin layers, down into subcutaneous fat, muscle, sometimes even bone.
Oh, wow.
The appearance is often dry, maybe leathery, charred. These are catastrophic injuries, obviously very high risk.
Okay, so we have the local damage, the redness, swelling, pain, tissue destruction at the site. But let's circle back to those systemic effects you mentioned for bigger burns.
Right, the body-wide response. This really kicks in significantly when burns cover more than, say, 20% of the total body surface area.
20%, so like both arms or the entire front of the torso.
Something like that, yeah. And one of the biggest immediate problems is hypovolemia, low volume.
Low fluid volume.
Exactly. Your capillaries, the tiny blood vessels, become super leaky after a major burn. Fluid pours out of the bloodstream and into the surrounding tissues. It's called third spacing.
So the fluid isn't lost from the body entirely, but it's not in the blood vessels where it needs to be.
Precisely. It's trapped in the tissues. This means the circulating blood volume plummets.
And that leads to
Low blood pressure hypotension. If that's not fixed fast, it can lead to shock. That's where organs don't get enough blood and oxygen. Life-threatening.
Okay, so fluid loss is a massive immediate danger. What else happens systemically?
Well, electrolyte imbalances are common. The whole body chemistry gets thrown off, and the body goes into a hypermetabolic state.
Hypermetabolic, like metabolism speeds way up.
Way up. The body needs huge amounts of energy and protein to try and heal such a massive injury. It's working overtime. This has big implications for nutrition down the line.
Makes sense. And you mentioned infection earlier. That must be a huge risk with the skin barrier gone.
Absolutely enormous. The skin is our main shield against bacteria. Damage large areas, and you've basically opened the door. Local infections are bad enough, but sepsis.
Sepsis being a body-wide infection response.
Yes, a massive uncontrolled inflammatory response to infection in the bloodstream. It's incredibly dangerous, a major cause of death in burn patients.
And are there other risks, like breathing problems?
Definitely. Especially if the burn happened in a fire. Inhalation injury, breathing in smoke, hot gases, chemicals can damage the airways and lungs directly. That's another immediate life threat.
It's sobering how many ways a severe burn impacts the entire system. Thinking about how these happen, the sources list some common ways, right? House fires seem like a big one.
Sadly, yes. House fires are a major cause. Scalds, too, especially in little kids. Hot coffee, bath water, happens so easily.
Yeah, you hear about those awful accidents.
And then there's industrial accidents, electrical injuries, think power lines, workplace stuff, just contacting hot machinery or surfaces, chemical spills. It's a long list.
Okay, so someone has a burn. What happens next? What are the crucial first steps?
Stop the burning. That's priority one. Get them away from the source, put out flames, flush chemicals off with lots of water.
Makes sense. Stop the damage continuing.
Exactly. Then, brief cooling with cool, not cold running water can help with pain and maybe limit the depth a bit, but only briefly, maybe 10, 15 minutes. Too long, and you risk hypothermia.
Right, don't want to make them too cold.
No. And then, again, straight back to those ABCs. Airway, breathing, circulation. Always the top priority in emergency care.
Okay. And for those bigger burns, you mentioned the massive fluid loss. How do we tackle that?
Fluid resuscitation. Aggressively replacing that lost fluid intravenously. That's where calculations like the Parkland Formula come in.
Ah, the formula. Our sources mention it. 4 milliliter times body weight in kilos times percent TBSA burned.
That's the one. It gives a target volume for the first 24 hours. Half it usually given in the first 8 hours after the burn occurred. It's a guideline to fight that hypovolemia and prevent shock.
It really highlights how critical fluids are. What about taking care of the burn wound itself?
Wound care is obviously huge. It involves things like debridement, carefully removing the dead, burned tissue.
Yeah, we remove it.
Because dead tissue is a breeding ground for infection, and it prevents healthy tissue underneath from healing, so you've got to clean it up.
Gotcha.
Then, topical antibiotics are usually applied. Silver sulfadizine is a common one mentioned, helps keep bacteria down. And then sterile dressings protect the wound.
And I imagine pain must be a major issue to manage.
Oh, absolutely. Especially with those partial thickness second-degree burns, they can be excruciating. So strong pain relief is essential, often opioids like morphine or fentanyl initially.
Along with other non-opioid drugs too, I suppose?
Yes, often a multimodal approach.
Yeah.
And then, as healing progresses, rehabilitation is key. Physical therapy to keep joints moving, prevent contracture.
Contractures, like the skin tightening up and limiting movement.
Exactly. And scar management techniques to try and improve the final outcome, both functionally and cosmetically.
The sources also mention surgery sometimes being needed, like escharotomy.
Right. If you have a full thickness burn that goes all the way around the limb, or the chest, the tough, dead skin, the Escher, can act like a tourniquet.
Cutting off blood flow or restricting breathing.
Both are possible. An escharotomy is a surgical incision through the Escher to relieve that pressure. It can be limb-saving or life-saving.
Wow. And what about skin grafts?
For deep burns, third and fourth degree, the skin is destroyed and can't regenerate on its own over large areas. So skin grafting, taking healthy skin from another part of the patient's body and transplanting it onto the burn wound, is often necessary to close the wound.
A complex process all around. So if we boil it all down, the absolute must-dos for significant burns.
Based on our sources, number one is early aggressive fluid resuscitation, combat that shock. Number two, meticulous infection prevention, huge risk. And number three, always manage that airway, especially if inhalation injury is suspected.
Fluids, infection, airway, the cornerstones.
Absolutely. Get those right early and you give the patient the best possible chance.
So wrapping up this deep dive, it's really clear that burns are so much more than just skin damage. The complexity, the way they affect the whole body, it's pretty profound.
It really is. Understanding of the different causes, the depths, those systemic reactions, it highlights how varied and potentially dangerous these injuries are. You really see why specialized care is so vital.
Definitely. Considering the immediate risks and the long-term recovery challenges, it really makes you appreciate the importance of good care.
For sure.
And it leaves you thinking, doesn't it, knowing all this? What simple things could we maybe change in our everyday environments, at home or work, to prevent these kinds of injuries from even happening? Something to really mull over.